Good morning. Thank you so much, Sarah, and of course for those lovely countdowns. Remember, this is 15 days past the beginning of July, and of course we are happy that you're doing good as far as your health is concerned. And mind you, of course, we've been having these conversations for quite some time, and one of the best impacts and the best structure we can elevate our bodies is to understand our healthy diets and the nutrition. If you're joining us for the first time, this is the health check right here on the Morning Drift, a conversation that you do not want to miss, because this is part and parcel of our daily life. What is the engagement in it? Remember, there's also the mindset that we need to adapt to when it comes to our feeding habits, or our eating habits rather, of course, to even understand the clear benefits and the clear structure on our feeding program. Ladies and gentlemen, do you think you are eating right? And as we ask this question, we are generalizing it to the public. Do you think Kenyans are eating right? There's so much output out there, but what is their choosing? What is the choice of food that we take on a daily basis? Now, we'll be joined in by our able nutritionist, of course, Persist will be helping us understand the benefits, the ways, and how we can have proper feeding hygiene or feeding technique, also healthy diet and nutrition. Now, allow me to read this. The Ministry of Health has directed all healthcare facilities in the country to get in touch with the Kenya Medical Practitioners and Dentist Council, KMPDC, and update their actual bed capacity. The directive comes after the ministry cautioned hospitals against admitting patients, emphasizing the hospitals should admit patients only depending on their bed and infrastructural capacity. I believe also with the many people that are in hospitals, of course, there's also a need to understand the food that they will be given.
Yeah.
Later on, of course, I believe Cheryl will be joining us. Of course, she's a nutrition coach to join in the next few minutes. But in order to shape this conversation, last week, if the audience were listening, we were having a conversation on healthy diet as well. And I'm happy that we are having a rejoinder on the same, to really understand the clear context on our feed, on our healthy diet, on our nutrition. And every day we speak about it because it matters. Last week, we also had an understanding on water, which is a key element in our feed as well. So there's so many things that we need to consider when it comes now to our healthy feed. And I believe if you also have a question to our nutritionist right here on live television, remember you can share with us your information or your comments, your suggestions, your opinion live on Facebook and YouTube. Use the hashtag health check, and of course use the hashtag the morning drift. Now let's begin with this conversation. So we are having an understanding on our everyday life and our everyday feed or everyday nutrition. When it comes to daily practices on our feed, what are the first things we take into consideration?
In terms of food, Moses, thank you so much, first of all, for the invitation again.
Indeed.
Maybe I could just introduce myself for
all right,
who tuned in last time. My name is Persist. I'm a registered clinical nutritionist and the founder of Tofali Nutrition, and also founder and director at IFJAD, Institute for Food Justice and Development.
Indeed.
So back to your question, it's one of the things or the foundations of healthy living is good diets.
Indeed.
Good diets. There are many others, including physical activity and reducing exposure to risk factors that cause disease. But when it comes to food, good nutrition is the foundation of healthy bodies and healthy communities. So, and we discussed that healthy diet means food that is balanced and food that is also safe from toxins and toxic substances. So that aspect of balance in food, that you're eating all the food groups and you're eating them in a balanced manner, not having too much consumption of some foods like sodium or trans fats or saturated fats or even sugar. That healthy balance then forms the foundation for healthy communities.
But on a daily basis, the clear understanding, of course, we need not to understand every day. You know, today it is Tuesday, you choose this kind of property to use in your diet, and the following day you adjust to another one. Everyday life, how do we make sure that we have a clear adaptation towards our everyday life feeding?
So this brings us back to the conversation on food literacy.
Okay.
Knowing food, knowledge of food. God has blessed us with so many varieties of food. So many varieties of food. Many of us, I think, there's this problem we have of over-relying on a few varieties of food.
Indeed.
You find that we over-rely on beans, we over-rely on maize, we over-rely on sukuma wiki, but there are so many varieties of food. And it goes back now, the food literacy aspect goes to breaking down foods into groups, onto carbohydrates, proteins, vitamins, minerals, and so on and so forth. And so everyday choices should be made with that in mind, that you're eating food knowing that there are these nutrients that you need to consume on a daily basis. And that in as much as culture also plays a significant role, culture can be either good or bad. And I'm going to give you two examples in our communities that I like giving as a nutrition educator. That you find, so I come from Mount Kenya region, and our food, people make fun of our food, for instance. They say it's boring and it's not very nutritious. And in many ways that is true. And then now we compare to food that people from western side of Kenya consume. Western is known to have a lot of varieties of vegetables, a lot of varieties of proteins, and they eat this on a daily basis, you get? So culture can either be good or positive or negative. And in either case, in both cases, it influences the outcomes of outcomes in terms of health of these people. So on a daily basis, the individual level, at the household level, being food literate is really important. Knowing that when I eat this food, there will be these implications. If I don't eat this food, there could be these implications. Like if I overconsume calories, I'm going to become obese or overweight. If I underconsume micronutrients like iron, I could be predisposing myself to anemia. So those are the choices that we need to make on a daily basis, having that knowledge, and also I think also backed up by culture.
All right. I believe in the next session, of course, we'll be having an understanding on how family, social engagement, and perhaps culture really affects or becomes a basic challenge towards our feeding. But allow us now to get to food justice, which now is the basic control in all this. And I am appreciating that IFJAD is doing a lot as far as food justice is concerned. But to someone that didn't engage with us last week, let's try break it down now, to really understand the the waves of IFJAD, and of course also to understand what it really means when you speak about food justice.
Thank you. You've mentioned IFJAD, and I think I introduced it as an organization or a non-profit that is working at the intersection of food justice and development. So what is food justice really? Food justice is two things. One is a framework, and it's also a movement. As a framework and a concept, it argues that everyone has a right to food, food that is nutritious, food that is safe, food that is affordable, food that is culturally appropriate, and that there exists barriers that hinder that from being a reality. And these barriers need to be tackled and addressed. These very deep-rooted structural barriers that make the right to food a reality. Right? And it also looks at now other issues like the welfare of food workers. So we know that our farmers, our fishers, our people who do value addition do so much good work in this country in terms of producing food. They spend so much energy, so much time, but when it comes to earning, they don't earn well. So the food justice angle now says that the food workers need to work on to make some good money from their work. So that's the food justice angle. Of course, now it looks at the entire food chain from the farm level to the consumer level. All aspects of justice in it, or injustice, including at the consumer level, where we talk about issues of food adulteration, food safety issues, food fraud, and the lack of, and now other more glaring, and I think we'll be discussing that issues of hunger in our communities. Hunger and malnutrition are those quiet things that happen in our communities and there are justice issues in food, and there are things that need to be addressed because they are a matter of the lack of justice in our food.
Indeed. You mentioned something about the rights, and of course this is, when we speak about justice, of course we are inviting rights as well. So do you think that there is a problem now when we want to make a choice? Yes, I know it's my right to take any kind of food that I want, but so how do we make sure that we are inviting the sense of hata kama ilikuwa right, that was choice. If it affects him or her, that was his or her choice. So how do we make sure that justice at the end of the tunnel speaks out?
That is a good question. When we talk about issues of food justice, of course we invite the conversation of rights. Indeed. The right. But you see now, this right means not just a right to eat food of any kind, but right to food that is nutritious, food that is safe, food that is also culturally relevant or appropriate. So that has to be put into context. That when you have a right to food, you have a right to food that is safe and nutritious, not just food that fills your stomach.
Who decides that? So
the issue of rights has been an issue that has been captured very well at the international space, in international policies or legal instruments. Like I'm going to mention just a few of them. One of them is 1948, the Universal Declaration of Human Rights. And in as much as this wasn't a legally binding policy or framework, it is more of a moral framework that guides countries on how to handle this issue in the country. That everyone has a right to a standard of living that ensures adequate, that is adequate for health. Yeah. The second one is the International Covenants on Economic, Social, and Cultural Rights of 1976. And now this one explicitly talks about the right to food. The right to food, that everyone has the right to food. And Kenya, many countries ratified it, and Kenya ratified it in 1972. So which means that now it is, so Kenya should be able to respect the right to food for all in this country. And there are many others, including issues of zero hunger, ending hunger by the SDGs that want to end hunger by 2030, and many others, including now the Constitution of Kenya, Article 43, 1C, that says that you have the right to be free from hunger and to have access to food of acceptable quality. So there are frameworks, legal frameworks that talk about the right to food very explicitly, both at the international level, African regional level, and also the Kenyan level. So it's not just something that exists on the vacuum, it is well noted. And I think the reason why they decided to do this is because they anticipated that there will be a lot of hunger happening from time to time because of various reasons. So it has to be put there that it is your right, regardless of whatever context it is. Whether you are a human being, you have a right to food and a right to be free from hunger.
All right. So usijinyime sana, usijikaze sana. There's a position that now, yes, of course it's your right, but after all, do the betterment to make sure that your health stands out at the end of the tunnel, right?
Absolutely, yeah.
Indeed. Thank you so much, Crispus. Cheryl, nice to see you this morning. You're not much far ahead, of course, with the conversation. We were just trying to build an understanding on the same, and I would want now you to introduce yourself once more, because you are a nutrition coach, and you help us understand now your perspective on food justice, even as we roll it down.
Oh, pleasure. Thank you. My name is Cheryl. I'm a nutrition coach, and I work with the Institute for Food Justice and Development. And yeah. All
right. So you've mentioned something on food justice. Now what is your understanding? He just said there's a room for rights, but also there's, it's my right, I can take anything. But when you speak about now food justice, what is the Mwananchi's understanding in all this?
Okay, so food justice, the core meaning of this is that we need to have nutritious, well-balanced, where variety and diversity is met at the plate. That is what we are advocating for, and if justice is done for food, from the farm to plate or from market to plate, I think that will be that will fit our aim of food justice.
Amazing. And the aim is done. And I'm really loving how Cheryl is speaking, because she is a coach, that means kula hii, chukua hii na ukunywe maji. It comes out clear. So I want to give you a test, Cheryl, as a nutrition coach, and of course people will want really to embrace how you guys do your thing. And Crispus is here. I'd appreciate that Crispus now becomes your, is it patient?
Yeah, probably.
Okay, patient. And you're the coach
client,
there.
yeah.
I want you to do for us how you approach these patients. That now he's coming to you and amekuwa kijinyima sana, he's not been eating healthy and now wants help. So he'll approach a coach as you. So what is the initiation of the first approach that you coaches take?
First, it's good to know the economic background of your client,
okay,
especially when it comes to finances. That's the core thing. I'll know this through other inquiries like, what's your background? What's your profession? Where do you work? From that, I'll know at least when giving a budget or working with some foods, we should work with the specific ones. For example, when we, in our local communities, from Kikuyus and to, I mean central to Nyanza, there are specific foods in those regions. So when I know that Crispus is working in maybe Nairobi and he is a teacher, I'll budget with some few ideas in my mind, knowing that this person can afford maybe a 3-course meal, or can afford to take 3 meals in a day. And through that, I'll also have a clue that he can afford to take a well-balanced diet only if we start and study much with him.
Yes. So what is your complaint?
My complaint is that I'm not gaining enough weight.
All right. Coach
or it was.
Yeah. Indeed. So he's complaining about weight.
So when he's complaining about weight,
to talk to him.
Okay. Hi, Crispus.
Hello.
My name is Cheryl. Yeah. Thank you. I'll take you through a nutrition coach, and since you've said that you not gaining weight for now, so could you please let me know your height?
1.8 meters, 180 centimeters.
Okay, and could you just give me a background of what you do eat, at least in a period of 1 week?
Mostly, so I'm very busy. I'm not able to get good meals because of the work that I do.
What do you do?
I work for Muhindi, somewhere in industrial area. And we lift a lot of heavy things, but time limits me to prepare a good meal.
Okay, so how many meals do you take in a day?
Major meal probably for dinner, but everything else is just snacking along the way. Yeah.
Okay, so dinner, it composes of
kawaida food, ugali, beans, cabbage, like that.
And so in a week, do you even take animal proteins?
Yeah, from time to time, like thrice or twice, depends.
And in your diet, is protein part of it?
Yes.
Even plant protein?
Plant proteins, yes. The beans, the dengus and whatnot, yeah.
Okay, nice. So I assume that you work with 1 meal a day, right?
I think so, yeah. The main meal, yes.
Yeah.
All right. So give us the solution now. So that was an engagement. Now, someone out there is also having that same condition, that same problem. What is the way forward?
Okay, from Crispus, we find that he's only taking 1 meal a day, which is the main or major meal, which is not okay, as he is working, as he's lifting a lot of weights where he works. So we would advise at least you take 3 meals a day. Yes.
A must?
Yeah.
Okay. All right.
3 meals a day, then a snack in between. But
if it is a must, so if I skip, what happens?
Skipping a meal is not good for your health, because especially depending with the activity or the work you're doing, as Crispus example, he's lifting a lot of weight, so he's very active. The muscles are working.
Indeed.
And remember, we build muscle through food and also activities, right? So he's losing a lot of, he's using a lot of energy, and therefore energy intake should be the same as energy output.
Amazing.
Yeah.
Energy intake as well. So the reason I brought about that engagement is now to understand the clear context on public health, to make sure that when we get to these positions, we are able to have an interaction with our nutritionist, our doctors, so we have a proper channel to embrace what we are suffering from. So it becomes very essential when we want now to improve our healthy diet and nutrition. Crispus, I'd like us now to we mentioned earlier on about the everyday lifestyle on our feed, on our nutrition. So when we embrace public health, what is the center stage?
First of all, I like what's before I go to that, I like the kind of whatever the small dramatic thing we've had, because it shows, many times as nutritionists, people come up to us as friends and tell me what to do because I want to lose weight or I want to gain weight, and they think there's a magic formula that I'm going to tell you 3 sentences for you to be able to lose weight. Just like lawyers keep complaining that people ask them for opinions. What do you think I should handle this? There are so many things that go into preparing a meal plan for someone, and so that is what Cheryl was demonstrating to us. So when it comes now back to your question on public health, what takes the center stage in terms of public health? I believe now you're asking now in terms of general, as a country, what we should be looking at in terms of to make sure that we are a healthy nation.
Indeed.
And I believe the conversation of food literacy and culture and awareness now come into play in this case. That whatever happens at the individual level is what collectively now forms the national reality. That when we are aware as consumers of what foods to take, if we are practicing it, if we are doing it, if the food is accessible to us, then we become a healthy nation.
Indeed.
Right?
Indeed.
So there are many layers into this issue, or the many angles. That for a healthy nation, then we need people who are consuming nutritious food regularly as a culture. We need food that is available also, because this brings a conversation of food waste and that we experience in this country. That I don't know whether you know this, Moses, but we lose up to 40% of the food that we grow, and yet we are talking about hunger in this country. A lot of food is wasted and lost in the chain because of spoilage, or because of whatever other reasons that happen, even at the market level. So that issue of awareness at the national level, issues of food availability, and also the issue of that culture now we have, because you could know that this food is good, but are you eating this food? So at the national level, this is what now makes a healthy country, or a country that is not healthy. And I like giving examples.
Okay.
What we are seeing in the developed countries like America versus, let me just give an example with Kenya. So, or Japan probably, international. America is struggling very, very seriously with overweight and obesity. Very, very seriously. Is it that they don't know the food they should be eating? No, they know. Is that the food is not available? America is food secure in many ways. But the kind of the culture, the kind of food that you see them eating on a daily basis is now what is bringing problems.
All right. So we want to take a short break, but before we get to that, only 2 minutes left. I'd like your understanding on our immediate approach. Yes, we're talking about, there is the ministry coming in, there is the effort in line, and there's so much spoilage and wastage of food out there. But with very few lines, what should be the understanding on public health?
Sorry?
All right, I'll get to that when we come now after the break. Of course, it's 25 minutes past 9 a.m., ladies and gentlemen. Do you think that the country or Kenyans are eating right? So when we come back to the next session, we'll be able to understand. And I was asking Cheryl Rea in regards to, so there is this public health concern. So what is the immediate sentiment to take into consideration when we are embracing public health? And inclusive of that, what should the Ministry of Health do to make sure that the sensitization on healthy diet and nutrition is at the center stage? And above all, we shall now assemble in understanding if symptoms persist. Yes, I'm adapting to these, I'm eating healthy, I'm drinking water, but there is still a problem. So ladies and gentlemen, you're watching The Morning Drift. Don't go too far. I'm with Crispus Kinyua and Cheryl Rea on Health Check this morning. Taarifa zinapochipuka na kutufikia papa hapa kwenye makao makuu ya chumba cha habari cha runinga ya Lookup, kwenye taifa, kwenye serikali, kwenye bunge, tunajitosa hadi kwenye sauti ya wenyeji ili kupata tu maoni ya wenyeji kuhusu masuala haya yanayochipuka.
Maana hii kitu inaenda kuumiza Mkenya kwa tax.
Hakuna kitu tunafurahia. Nothing. Absolutely nothing.
Sisi tunaumia, si ati tunaumia ile ya kiukweli. Juu maisha ni ngumu.
Na bila shaka tunapata maoni yao ili sauti yao ipate kusikika. Na watasema hili, waseme lile, watasema hiki na waseme kile, almuradi sauti yao ipate taa.
Mambo ya mafuta tena imekuwa ni changamoto zaidi kwa kila mtu, kwa bodaboda.
Uchumi ikikuwa stable, tunaamini mambo itakuwa sawa sawa.
Kwanza liko na ria wasa wa boda, mama mboga nini. Hao sasa ndio wamefinywa zaidi maji.
Mtazamaji, hii ni bunge la wenyeji.
Start your day with a workout routine, an exciting moment of exercise that is simple but powerful for your ultimate fitness. Build your strength, shape and body muscles with lunges, push-ups, squats, burpees, planks, dumbbells and more. Let's work out every Monday to Saturday from 6:30 a.m. on Fitness Zone, a one surefire way to attack your fitness regimen effectively.
Save a Life is a non-profit organization that has taken the front line in transforming lives in the entire country. So far, we have transformed life of over 100,000 people through our programs, which include medical support, youth empowerment, street family program, feeding program, and climate change. Join us today as we transform lives. As we always say, service to humanity is service to God. Save a life, transforming lives.
People are there to belittle you. When people are questioning you,
if you don't move fast, of course, yes, you lose it, but then it's not us to push you.
But you do not know the God who has been molding me. What has he been doing to me?
The deep and mature conversations of empowerment for you with a curious mind and an appetite for oriented conversations.
I concur with what you're saying.
You plan your finances, you can easily live without a debt.
An engaging safe space of free expression and truthfulness with an upheld vibrance, motivation and happiness.
So many children who are there, they are not living their dreams.
Join us for deep conversations with Zipporah Gashushe every Saturday from 8 p.m. The Deeper Conversations on Lookup TV.
Welcome back. Now, thank you so much for choosing Look Up Television right here. Of course, on the desk, your health check, really understanding sana sana hii food inatupeleka namna gani. Earlier on, when we started the show, I was reading something about the Ministry of Health, and in a statement, it's a serious thing because it's creating a lot of attention right here in the Republic as far as the Ministry of Health is concerned. Now, the CS directed the hospital heads to ensure they acquire additional beds in their facilities to prevent undesirable conditions such as patients sleeping on the floor or sharing beds. Now, Aden Duale asserted that the directive not only aims to streamline healthcare service provision in the hospitals, but also restore dignity in the facilities. So we are really praying for the best. And of course, because the situation now is alarming right in the Republic, na history Social Health Authority, sijui itakuwa namna gani, but we are hoping for the best as far as this ministry is concerned. Not forgetting that the economy is now still on a crisis, and when stories are health ziki come through, there's still a burden of consideration right here in the Republic. But away from that, now, do you think Kenyans are eating right? We're embracing the story on public health, and we want at Cheryl. You're supposed to give us an info on the same. I do not know what is your output on in regards to the question we asked earlier.
The question you asked earlier, the good approach I can give it is that most of our roads are not that well, especially from the rural part of Kenya. And we find that most those parts is where our food comes from, and also other parts of Kiambu County though. So to reduce wastage or loss during the transportation, I think the roads should be so efficient. And the other another thing, to introduce gardening in our hospitals, for food security for patients.
Do you think we're doing that? Are we doing that?
No, we're not doing that. We're not doing that. So that's also, that can be considered as well.
All right. What is the effect? Why are we not initiating that?
You find that most hospitals in Kenya, I think they just don't understand the importance of having a garden in the hospital to add on food nutrition, and also I think it's something that the government is not implementing as well, because when the government starts doing that, the hospitals in Kenya will know the importance of that.
Later on, of course, we'll now be able to shape a clear nation towards achieving healthy standards. No, are Kenyans eating right?
That's a very good question and a debatable one as well. But I will say that there has been increasing awareness with regard to food, but it's not high. So majority of us are not eating right. And I could categorize this into two ways, the urban context and the rural context. And are urban people eating right versus are rural people eating right? In both cases, majority, I would say no. And the reason for that is when you look at statistics now from the Ministry of Health, we have been seeing a consistent rise in terms of non-communicable diseases, NCDs. There was a study that was done by KEMRI, and the data shows that 39% of deaths occur because of non-communicable diseases. And that when you look at the top 10 causes of death in this country, you find that it's because of the same non-communicable diseases. So the best way to show if people are eating right is looking at the data from Ministry of Health, because people go to hospitals and data is captured and published. And you could see that the issues of cancer are rising, issues of diabetes are rising, issues of hypertension rising, issues of cardiovascular disease. I think if it's not the first, it's the second cause of mortality in Kenya. Why is it happening like this? And mark you, it's not just in now urban contexts, because there's this notion that people in towns don't eat very well.
Indeed.
Nowadays, even people in rural areas are not eating very well. And the reason for that is because of our over-reliance on cash crops. Majority of, a lot of these productive places have cash crops. You cannot eat cash crops. You cannot eat tea and coffee. You could sell it. So you find that without good mechanisms to grow food, even for rural people, they are also not eating right. So Yes, I would say that we are not eating as well as we should. Yeah.
All right. What makes him think, and of course, what makes us believe that indeed there is a problem, and we just need alignment in the country's food opportunities that are available. Of course, there's so many stalls out there, and it's a matter of choice. But in regards to that, there is just a problem right in the Republic. And of course, if you see anything out there, you just wanna give an intake, right? And that is why we are having so many problems in regards to our health issues. Not only because we don't have food, or because of our choices. So what will be your take on the state of feeding hapa Kenya?
The state of feeding hapa Kenya, it's one thing, I can say so. And you see the business of smoky, I don't know, it's called smoky. Yeah. It's really doing well. And you remember WHO rated it as grade 1 of the most carcinogenic food or meal in their research. And that is also alarming, because most Kenyans are now eating smoky too much. You find that somebody can even take a small chow for lunch.
Sifiti,
it's not okay, because it's carcinogenic. It increases your chances of getting cancer at a higher percentage when consumed frequently. Yes.
Frequently means on a daily basis?
Yeah, at least
but there's so many people that are lovers of this mocha thing. Of course, if you speak about smocha, you'll also tell us about mutura.
For mutura, yeah, Christmas will let you know about mutura, because I find it unhealthy, because
you don't eat it?
I don't take mutura. Yeah.
All right. When you mutu,
so yeah.
All right. Of course, in understanding that, the reason also we're pushing that is to really understand these mistakes. Yes, it's very sweet. It's really good, but above all, it's something that you have to avoid. For the ndio unapata watu wakiwa wazee, they start to develop issues that zingeavoidwa at a young age. In order to help us understand that, you are a coach, and you are helping us to balance our nutrition in the better way possible. At the end of the tunnel in the evening, I'll take a balanced diet. But from morning, as just Chris had mentioned earlier, from morning to around 4 p.m. hivi, vitu ambavyo ulikuwa unakula, they are totally off. Then do you think that now the food in the evening will at least now bring you back to balance?
No. Actually, we live in our body. Therefore, we need to understand our body well. You need to understand where you live, okay?
Okay.
So it's good you understand that your body needs to take food.
All right.
Because nutrition is the fuel for your body. And therefore, we are educated right now, and we are now understanding that taking a meal is one of the most important things to do, because when you're sick, you take a drug. But the food is something that should be taken consistently, so that we may get energy to fuel the body. The brain uses the energy, and our daily activities, we need the energy, and all this energy is we get them from food.
All right. I would like, of course, Chris, to mention on this, but before we do that, there is the aspect on market to plate that. You'll give us the body on that, but Cheryl, what is your feeling? Since you're a coach and the development comes in handy from your end, we'd like to understand. So the food is here, either spoiled or not. It is just right at the market, so you have to get it to your plate or to your home. So what is the initiation point when we want now to make adjustments towards this food that is available right now?
You just mentioned that you don't care when the food is spoiled or not, right? There is that cycle of life.
Okay.
Even us, at the end of the day, there is death. We return to dust. So the cycle of life, there is this way that the food is not ripe yet, it's get ready, and then it starts spoiling.
Indeed.
It's advised that we only take something that is ready. ready to be eaten, because when it's ready, it's when the nutrition component of it is well captured, and also it will be more nutritious on that. So making healthy choices is one of the important things to do, especially when it comes to nutrition.
Awesome. Well answered, of course. Chris, what is your feeling on the same?
So I think I'll go a bit back on, she's said some very interesting things, and back to the conversation of us eating right, and say that some studies have been done and show that Kenyans do not eat enough seeds, enough nuts, enough fruits, enough vegetables. And these are all categories of food that are very nutritious and have protective roles in the body, like now seeds and nuts, macadamia nuts, peanuts, and many others, almonds, and all that. And now the seeds as well, chia seeds and many pumpkin seeds and so on. I don't. If you ask someone, when was the last time you ate pumpkin seeds, they will fumble. They may not remember. And then I'll go to what are we eating instead? And if you look at many of our urban spaces, the street food, majority of the food you find being sold is not the food that's what she was saying. It's not healthy food.
Indeed.
It is food that is high in calories, but not high in other nutrients. If you go to a street selling a lot of street food, you will find probably just one or two people selling these tubers, these ngwashe and doma, and probably like 10 of them selling mandazis and chapatis and samosas. And she has talked about how, which is really important, how smokies are becoming very popular. And she said how WHO categorizes processed meats as a category 1 carcinogen. That is the highest rank of carcinogens that we have. It is categorized the same as other serious carcinogens, I think like, is it mercury? So, I mean, we need to reduce our intake of the smokies and the sausages that we are seeing. And in as much as they are very tasty, we need to be very cautious about it. And I wish more experts were telling us about this, because you see some of the preservatives used in processing meat are actually well-known carcinogens, but they have to be put there. The reason why they are added in meat is because if you don't do that, then you are at risk of public health catastrophes like these what we call botulism, caused by a very, very toxic bacteria. So they have to do that. So then you need to know that you shouldn't take too much of it.
Okay.
So you see sometimes, especially comrades, you see someone taking 6 smokies or 10 sausages. So that is not very good. The best alternative now is the healthy options like mayais. I'm an advocate of mutura because
boiled,
boiled or fried, whichever. Mutura is also okay as long as it's made well, with ethics in mind. And she's right, because many of the muturas in towns are not so good.
Okay.
They are making it in all manner of ways, and it's not so good.
So you should have a spot. So it's a good spot where you're taking your mutura.
It's very, you know, the people you trust, sometimes they can let you down. So it's really difficult to trust.
And you saw dogs trending.
Dogs and cats. You know, so it's really...
Okay. So on July 1st, an exclusive article was written by Reuters says most packaged food in Kenya will need health warning label under new rules. So that report says, it says that around 2/3 of the products will also be deemed unhealthy based on the models used internationally like Nutri-Score, which unlike the model, Kenya also take into account positive nutrients. Neither the Kenyan government nor the company has responded to the request for comment. Now, previously tracked products globally and in countries like the US and India, but the Kenya report alongside one Tanzania is the first of a kind in African country. So there is a burden in that, and that is why we will come to the understanding on nutrition on a budget. Whereas we're talking about, in the tough economic times, we are having instability in our feeds. So mimi natafuta tu chakula ambacho kitakuwa rahisi sana kununua na kutayarisha, mostly to those people that are bachelors, just like I wouldn't say the name. This is the point. So when we want to understand this clear context on food on a budget, and many would want to prepare at least chapati and mayai or ugali and mayai because it's ready to prepare. So the entire week he'll utilize that. Thereafter, we'll also come to the fact that ni kubaya sahi, economy ni mbaya. I'll try as much as possible to use the less amount to buy food. Or rather, this person might decide now to go to a hotel where he'll just try receive a cheap meal na siku ipite. And mind you, the entire time hajakula vizuri. So what will be your take on nutrition on a budget as a coach?
Okay, nutrition on a budget, I can recommend that you do a substitute of each and every food group. We have some food groups that are very expensive, especially when it comes to animal product, the likes of chicken, beef. So we can do a substitute of them, giving a plant protein because they are much way cheaper.
But tunaongelea hapa affordability. Your beef ni how much?
Is beef cheap than
not cheap.
It's not. So therefore, you can do a substitute of beef. We have, I was going to say soy. So you see the soybeans, we have beans, we have the likes of njai, the likes of chickpeas. Those are cheaper, at least cheaper when you buy them at your local market. And when you do a variety and diversity of the same substitute, you find that you're going to get the all nutrients that is found in meat or beef. Yes.
So Kenya is the tipping point where they could follow in the parts of countries like US where Christmas was saying about obesity, and we are seeing really high levels of obesity and overweight, or they could act now to try prevent that. And that is why I'm happy that we are having these conversations on a daily basis to make a change, right, kwa watu ama sisi binafsi on our feed. When we embrace that, it's just mentioned substitutes. So how will we clarify this to make sure that we have the betterment?
That's a good question, and it's actually food, not feed. Feed is for animals, food is for us. Is healthy food expensive? And remember you asked actually this question last time. I would say yes, but it doesn't have to be expensive. If you go to a supermarket right now and ask for seafood, you will find some costing 2,000 shillings per kg.
Amazing.
But if you go to Lamu, and some remote place in Lamu where fishermen are, the same costs 200 shillings per kgs. So what am I saying? I'm saying that part of the reason our food is expensive is because of the realities of our food systems, that it's very broken, fragmented, disconnected. Food is cheap in some places and it is rotting in farms. Food is very expensive in some places and it is unavailable and inaccessible for many consumers. So what we need to now do is to fix now the connections. And she talked about infrastructure, roads, as part of the reason why food becomes unavailable for many people. That we need to bring that food into where it's needed the most, where consumer demand is high. Because food does not have to be expensive. There's no reason absolutely as to why food should be inaccessible for people. And maybe just to add, I could say one of the other ways we can make sure that people eat healthy even on a budget is looking at local food, seasonal foods. You see, like now when it's mango season, you can even find mangoes for 5 shillings. And if you go to what we call mashimo, you can even find mangoes for 1 shilling. You know, when the seasons for rice, for maize and whatnot is ready, you find these foods are very cheap. Now that the issue of now substituting animal proteins for plant-based proteins is a good idea. And we need now to bring the conversation of indigenous foods. The foods that our forebears grew, our grandfathers, our grandmothers. We grew many types of foods that we have done away with the millets, the sorghum, the indigenous varieties of maize, the many types of vegetables. So rather than just eating, now going for knowing that there's only broccoli and cauliflower and carrots, let's look for those indigenous vegetables. They are cheap.
All right.
And also this issue of territorial markets. We should have big markets in every, just many markets anyway, in all these spaces. These markets are important because we find cheap food there.
Indeed.
You know, yeah, you find cheap food rather than now waiting for if there is a problem of budgeting, waiting for Mama Mboga to bring it to you and selling them at in as much as they need to make money. But if your budget is not good, look for main markets.
Indeed.
Yeah.
All right. As we come to the bottom line, Cheryl, we are now having the question on if symptoms persist, then what should we do? From your professional angle, yes, I've tried all the means of what you've embraced, also we embraced with the CRISPRs last week, then things are not working out. So, and I feel that there's still a problem. So if symptoms persist, what should I do?
I understand that nutrition is a mystery sometimes, because the body is unique and made in different ways, because my body is not the same as your body.
Okay.
And that's why we have different DNAs. They can't be the same. So different body, your body will digest or use different food in different ways, very specific and unique in a unique way. Therefore, it's just good to understand what your body needs. You can try, try if this food is not working for you, because sometimes we can say, yes, this is the healthiest food, do this and do that, but that person, they react with this food. So understand your body so well. When you can take specific food and it's going well with you, please do. And when it's even the healthy food you're allergic to it, don't use it.
So, how can we get you on your socials, and of course, how can we interact with you when we want this good coaching for nutrition as well?
For that, I'm on WhatsApp and also LinkedIn. Cheryl Ray is my name. I'm on TikTok, yes.
Amazing.
And I'm also on Fiverr. Fiverr.
Oh, okay.
Yeah.
Me too. So nice to have you, Cheryl Roya. Thank you so much for honoring the invite. Thank you so much for coming. I think those are lovely thoughts as well from your perspective. Then I'd like now, as we end this conversation, we have 2 minutes, you give us your last punchline. Yes, we've been embracing this, but now this is our call to action.
My call to action now will be as a food justice advocate or champion, and say that address the issue of hunger and lack of food, and say that people are not hungry because there's not enough food. People are not hungry because of misfortune. They are hungry because of the failure of institutions. Institutions responsible for making sure that food is right for everyone have been failing, and so that needs to be addressed. These institutions need to wake up to make sure that they are doing their part in terms of making that everybody has access to healthy, safe, nutritious, and affordable food for
Indeed.
all.
Thank you so much, CRISPRs, once more. Thank you so much for coming. Thank you so much, Cheryl Roya, for making time for us. Now, ladies and gentlemen, we were embracing the conversation right here on healthy diet and nutrition, and of course, we were just understanding on whether Kenyans are eating right, and of course, we also had an adaptation on what to take or not what to take as well. And of course, if symptoms persist, seek medical advice, just as CRISPRs and Cheryl, of course, for more helpful engagements as well. Now, let me tell you this. Look Up Television, courtesy of the Morning Drift, will now take its new turn coming next week to really embrace now what is really happening in the country. And of course, we'll have a different kind of program from Monday and Tuesday. We'll be having political conversation, and of course, on Wednesday, we'll engage on matters business. Thereafter, we'll shape a conversation on societal matters and health conversations. And thereafter, on Friday, we'll be getting on the bottom line of the entertainment and artistic engagement. So, ladies and gentlemen, keep staying tuned right here on Look Up Television. Of course, this is the only way we can keep engaging. And of course, follow us across all social media platforms. We are live on YouTube, Facebook, Instagram, TikTok, and also our website is running, www.lookuptv.co.ke, for betterment of these engagements. Subscribe, cheza kama wewe. My name is Master Sketch. My director has been Sarah, and of course, see you next time as we embrace other conversations. And of course, I can't forget, thank you so much, Liz, for the good job. Well done. See you tomorrow as we purpose for societal engagements.
We value your feedback and welcome your complaints about our programming and operations. Feel free to get in touch with us through 0700 89